So this video lecture series is going to talk about something you may have experience with, and that's acne. I'm going to provide you with some of the science and give you some of that background on what causes this skin irritation that's very common. So first off, I want to provide you with some resources for some more information. I've pulled some of my information directly from here, and I'm going to kind of cover it briefly, and you're welcome to check out these scientists for more information. I provide you with the links to their PowerPoint slides. First off, remember that acne is one of the most common skin diseases, with about 17 million Americans affected. According to the data in U.S. research, close to 100% of people between the ages of 12 and 17 have acne. And genetics do play a role, but they're not the sole or potentially only cause of this. So people were surveyed, about 503 here, and nearly 50% of the respondents to the question, what do you think causes acne, said cleanliness of skin. Many people believe if they keep clean skin, they won't get acne. And sadly, this is not the case. This does not hold true. And we're going to talk about why that is. So what does cause acne? What's the true cause? Well, acne is caused by the plugging of follicles, which is mostly due to excessive sebum production by sebaceous glands, stimulated by the influence of androgens, which are male sex hormones, testosterone being an example. I have the oil well here because we have the excessive oil production. That skin keratinization and plugging of these follicles speed up the formation of acne. Normal skin bacteria produces irritating substance that can cause the inflammation. There's also external influences such as friction, and also medications can also be causes of acne and cause that to be worse in some individuals. The kind of quick summary of what acne actually is, it's the plugging of the follicle to begin with. There's also excessive sebum production and the presence and activity of the bacterium. Propionibacterium acnes is the actual bacterium name. Ultimately, this will lead to inflammation, and that causes the redness to be seen. Looking at diet, stress, and acne, well, there's a controversial link between diet and acne. Does it cause it? Does it influence it? Although many patients believe that their acne is influenced by certain foods, Western diet may be associated with acne. There's kind of that glycemic index that can potentially be linked to acne, but it's not necessarily as much of a presence as we may think. Skim milk may have some of these androgenic hormones, and that could be associated with acne in teenage girls in particular. Stress, acne among university students was associated with exam stress. So there is a chance that some instances there can be these factors that may influence it, but it's not necessarily the main cause of acne. Are androgens and acne the male hormones? Remember, some of these male hormones, while entitled male hormones, example testosterone, are found in both males and females. The reason why they're called male hormones is they're found in higher concentrations in males. And these can cause the oil glands of the skin to produce more sebum, which is more oil, and that excessive sebum production can lead to that increased evidence of acne. Now there's two main forms here that can occur, two main conditions that can result in acne. One could be a high hormone level. This increased amount of hormone can lead to overproduction of sebum, which you see here. High hormone level, excessive oil production. There's also another condition, could be high receptor level. This can make cells overly sensitive to the signal, resulting in high production of sebum. So if there's a lot of receptors, even if there's kind of lower amounts of the hormone present, there'll be a lot of binding sites, and that can lead to a lot of oil being produced, resulting in greater incidence of acne. Now, cause of excessive sebum production and increase of our androgen here, hormonal secretions become higher during puberty, which causes the sebaceous glands to become larger and simply produce more sebum. Remember, it's that key sebum production that is causing the main cause of that acne. Now, it does occur in both males and females. Women can have the menstrual cycle being pregnant, starting or ending, can take contraceptive pills, which can cause hormonal changes. It can influence them even further. So as I said, medication can cause that. Certain hormone level changes can also influence the sebum production, which then will result in acne. Heredity and, like I said, drugs can also potentially influence this. Looking at the variations of acne, we have a very light condition here, well characterized by whiteheads, blackheads, For example, very hard to see. Moderate, which is inflammatory, increases and becomes more serious. And of course, the severe case, see here, can also result in scarring in the most severe cases. Now, looking at some facts and causes about acne, most people think if they eat chocolate and greasy foods, for example, the nice chocolate bar or the French fries, will that cause it, acne to occur? Well, there's no scientific proof there's a correlation between that. Will dirty skin cause acne? Well, acne is caused by excessive production of sebum from the skin, not necessarily dirt. Can stress cause increased acne? Getting ready for an exam or a big test. There is potentially some relationship there. However, recent studies do show these corticosteroids, which are increased during times of stress, may stimulate sebum production and hence worsen acne. So it may not be a direct or always a direct cause, but these corticosteroids, if they increase that sebum production, that is what then will result in acne. Facts about treatment of acne. Why do I get acne despite washing my face several times a day? Well, too much washing can actually irritate the skin further and worsen your acne. So gently washing your face daily with a mild cleanser or soap and patting it dry can help reduce acne, but excessive washing is actually a bad thing. Some people believe if they just let acne run its course, it'll be fine. Well, if you have those severe cases, it could cause scarring. Should I squeeze the acne? Should I kind of get rid of it that way? Well, squeezing can actually cause that infected material to go deeper into your skin. And if acne cannot be cured in a month, then should I try other drugs or treatments? Well, typically these are very slow acting, which is again not what people want to hear. But you typically have to wait over a month to see if there's actual effects. So just because you try something next week or the week after didn't work, it may take longer for that to actually activate and see results. Lastly, the purpose of these acne treatments to decrease sebum production. That's the key part here. We reduce the bacterium, reduce the keratinization, and eliminate inflammation. Dermatologists would be the best. They can combine 2 or more treatments to create an effective therapy to prevent new lesions from forming. So why have the 1 + 1 equals kind of 3 here? Well, in certain cases, you could try 2 separate treatments and you could get a very positive effect, more than just each one individually. So this kind of just relates to the purpose of acne treatments. Each individual is unique, and dermatologists can have more tools at their disposal, have seen more cases, and as a result can suggest the best mode of treatment for you in your individual case. Remember, if they prescribe something to you, you may have to wait over a month for it to work, which may not be what you want to hear, but hopefully the goal is that long-term reduction in sebum production to ultimately reduce your acne.